This is the Business Chat Podcast.
All right, welcome back to Season 5 of the Business Chat. I'm once again with my new friend, Sean from Cogent, and Sean's bringing his friends on the show. It's really cool. Our guest today is Dr. Brian Kolender. Brian, good to see you.
Thanks. Thanks for having me.
Yeah, thanks for coming on the show.
So I'm honored that we're in the midst of greatness right now. I just want to let you know, and he'll explain this, but he is the person, and I know I interrupted you, but he is the person that is truly going to change the way healthcare is managed, and he's actually going to help people live healthier lives, better lives. I mean, he's truly going to impact it, what he has done. So I know he said he committed to giving signed autographs to everybody, before he leaves. So thank you for doing that. I appreciate that.
Anytime.
So thank you for giving. So make it out. It's SHAWN, please.
Do you have the pen that I requested?
I do. I have the Cartier. Absolutely. I have it available. Or Cartier, as we call it with my family. We call it Cartier.
Cartier.
Yeah, Cartier. Yeah. So we go to Tommy and that Louis Vuitton store in Somerset. So anyway.
To the Cost Company.
Yeah,
yes,
it is.
Right, yeah.
We go to Costco's. Yeah. But thank you very much, brother, for being on. I really appreciate it. And I think one of the coolest things is when we were connected through a mutual friend is just that, you have a history, right? A 30-year history of doing private practice and doing concierge medicine and the impact you've had on people's lives. And we'll talk a little bit about that in a little bit, but that is just super impressive. And the cool thing too is taking the solutions that you've had for people individually and now commercializing that into like the middle market companies that can make a difference for the masses. And so I'm grateful for what you have done and have allowed others that aren't part of your concierge practice to be able to become part of, if they qualify, of course, the HuBe Health Program.
Yes, exactly.
And I think that's just really, really neat. And I think that, in all seriousness, the impact you can have on people's lives, right, to live a better life. And so instead of dealing with this stupid, crooked healthcare program that we're dealing with now, that you go so far upstream to help people literally live a better life. And instead of being controlled by drugs, you help them adjust and lead a better life with better behaviors. And I think that that's super cool, being someone who've barely passed biology, right? So I'm grateful that I actually understand what you're doing. And so I think it's truly fascinating. And, obviously your practice is in Beverly Hills, Michigan, which is amazing from a concierge side, but also this HuBe Health that you've started and that's starting to get some legs and some traction is truly amazing. And so we're going to, obviously, thanks for coming on and letting us talk about that and me asking you some questions, with regards to that.
Fabulous. I'm ready. Ready to tell you everything I know.
Well, so let's start with like a super simple question, which is the epic problem question, right? I say that kind of tongue in cheek, right? But when I look at that epic problem, so share about the epic problem that you help solve, right? And so as you're thinking about that, is obviously an epic problem is one, this is for the listeners, that you can't just write a check and make go away, right? I know like our healthcare system has tried, right? And our pharmacy system has
Money's not
tried.
Fixing it.
Right. So they've tried to write a check. It's just
not
not going to happen.
A lot of rich dead people.
Exactly. A lot of rich dead people, right? And so the other key thing is that you have to work collaboratively. And that's one of the unique things about your team and your organization. But also then you have to think strategically and implement tactically. And so in doing that, can you talk about the epic problem that you're helping solve? I mean, I think it's phenomenal.
Well, thanks. I'm going to talk about this in terms of like the lead in you gave me, which I appreciate. Thank you. The problem to me has changed. Like it started with, I want to be able to provide the care that I need to provide to my patients, which led me into concierge medicine. And that started with recognizing, I'll say before consolidation happened in healthcare, that it was happening, and that's not a good environment for me. I want to be able to do what I want.
Right.
And that led to concierge. And that was the problem I was solving at that time, is being able to provide the services that I needed to provide, not be limited by what's covered by insurance.
Right.
Then we've evolved to recognizing opportunities in prevention, which is just where I led my ongoing evolution of the practice. It's always changing. And then in the last few years, I realized that in prevention and in primary care, a lot of the goals are data driven. And if it's all based on data, well, then you can scale it.
Right.
And and just it's been a process of fine tuning that problem. So what are the epic problems? It's poor access. People even with insurance can't get an appointment. Or even if they have insurance and get an appointment, they can't afford their deductible or their copay.
Right.
So
they don't even go.
They're functionally uninsured, even though they have insurance. So cost, access, the cost to the payer, and this is where you come in, Sean, is recognizing opportunities to lower healthcare costs to payers. And then there's the fact that, this just kind of came naturally, is that, I focus on prevention, which is not part of our healthcare system in any way, because it's all based on definitions to me. A diagnosis, requires that you have a defined illness. Sure. And that defies the concept of prevention. That you can't prevent a disease you already have. You got to prevent it before it happens. Sure. So you've got to break away all the silos. You got to break away all the definitions and create opportunity. And I'll say, just fortunately, we've kind of walked into that.
Right.
Well, I think it's really cool too to add to that you also create that transparency, and for people to in a really easy to understand format of, oh my goodness, I didn't know this, right? And so you help them realize through a couple of things that you walk people through. We'll get into the function here in a little bit, but as you walk people through that without a lot of detail, people can understand, oh my gosh, if I do these simple things, I'm not going to have a heart attack or have a diabetic or become diabetic. And I think that to me is just, those are two driving epic problems as a society. And I just think it's phenomenal that you have helped solve that to those that obviously qualify or get a chance to meet you and your team and how the system works.
Well, thanks. So, the question there is education. Yeah. So whether you as an American knows why the healthcare system is broken, in your heart it's broken. People who go to the doctor and they still have bad outcomes from whatever disease process. So that the system isn't working on that level. So education is really important, and to tell people this is what's really happening for this disease process, whether it's diabetes or vascular disease or blood pressure and cholesterol, because we focus on cardiometabolic risk, which is the new fancy term for heart disease and diabetes. So you wrap all that in a bow, and it's called
causes.
It's diabetes. It raises the cost, doubles it. It's right there. If you're diabetic, you're costing whoever's paying for your health care, you're adding 40% to the cost. Right off the bat.
What you said, and I know you're going to ask a question in a minute. I just want to add something that's super cool. Is the word cardiometabolic, right? If you think about that, that is a tremendous Scrabble word, right? And so to me, it's like, think of the points that you could get off using that word. That's a bonus comment for
pro tip for people commuting to work
for
today.
Scrabble people.
Right.
I'm not very good at that, but I just wanted to say that for kids, listen, understand, Dad now has a new term, the cardiometabolic, that I'll be using.
Runs off the board.
And it is an actual word because we said it here. So I'm sorry, Drew, to derail a little bit, but I just wanted to point out that
you didn't derail anything.
Is a tremendous Scrabble word.
That's a great takeaway.
Yeah.
Well, there was a
I'm writing it down.
There was a term you threw in, I think, for listeners and for myself, I speak for them, that you mentioned before when it comes to medicine and prevention. And you were talking about having, remind me of the phrase you just said, it was a boutique kind of an alternate approach, right? And so basically we want to move into, as we transition kind of our questioning here, is really, as you're for prevention here, we wanted to hear kind of the purpose behind that, like see your personal, professional, and really either one, understand kind of what your angle like is you as a person. Because we love to do that on the Business Chat. It's get to know you as a guy, right? We want to hear more about the health system, but bring yourself into it a little bit.
Sure. Yeah. So this is going back, almost at the beginning of me becoming concierge and realizing, right. Yes. So concierge means that someone's paying you a retainer to provide the healthcare services. And So what I use with my retainer is I pump a little value back into the product. It's not just for me and my time. I want to have value there. So I include preventive services, and I'll say that all began, again, that's been an evolution of like, well, if this is a good thing, I've learned about this blood test and it's a good blood test and it's not really covered in, well, what else is good out there that I can learn about? And you're just learning what's out in the world that's not part of the insurance, what you can get easily with insurance. There's a lot. So what opened my mind, I went to a lecture with Daniel Amen, who's a pretty famous psychiatrist who does, I'm going to use the word brain prevention, but I'll say on a scale that really, in my opinion, isn't scalable because it's too expensive. But he's good at what he does. And he said some things at this lecture, which was, if you are not walking the walk, if you're a doctor and you're leading people and you're not walking the walk, you're a shitty doctor. And I heard that and said,
that's
done.
True.
And I went, and right then and there, I had my last Coke. Like I was like, I'm done with, I had a Coke a day, or whether it was diet or whatever. I'm done. I ordered a fruit bowl, from at this lecture hall instead of getting the stuff on.
We have 4 of them outside here.
Yeah.
I hope you noticed that.
And that was it. And like, I just said, okay, I'm going to start eating healthy and exercise and cut out the chemicals out of my diet. And that's kind of like the beginning. And it's a process. That's where it began. And also my wife had a health issue. I mean, minor, but she went to see like a holistic doctor who put her on hormones. And like, I watched her get better like in 3 days. So I'm like, okay, there's something here.
Yeah, I need to learn more about that.
I just watched this happen. I better open my eyes to some non-traditional opportunities.
And that's kind of the theme today, is you're bringing light to what I'm hearing all over. It's happening all over the internet. My generation, 40s, old guys, by the way, and younger kids are starting to kind of call BS on everything from when it comes to what they're being prescribed, big pharma. Again, we could be here all day, but
it is BS.
It's the era of folks kind of self-diagnosing, WebMDing, and kind of getting some results and going back to their doctor and they're saying, wow, your joint pain's gone. I don't understand. You never took your prescription. And they go, yeah, I just started walking and added some potassium to my diet because I read a blog, right?
It's remarkable how little information that a traditional doctor will give anybody.
Right.
It's just, here's your symptom. Let me do my testing that I get billed. I get paid for, and here's a prescription,
which I get money on,
and no comments at all about preventative methods to apply.
And to jump in front of your question that's coming, I guess the implication. Correct me if I'm wrong. It feels as though the doctor in the metaphoric, clinic, the hospital. You just described how that's kind of all been orchestrated to work by the system that we're talking about. Is prescribe, after there's the issue, send them out, the pills go down the,
It's, well, the symptom generates, a diagnosis. Yeah. Now they can bill under the diagnosis, and if I'm going to take, again, the most cynical possible approach, that doctor's going to bill for every test they can possibly do under that code because they make money for doing it.
Billing the insurance.
In one way or the other. And then they're going to prescribe a drug, based on the findings or no findings.
So you're saying that doctors are motivated by making money off of tests and prescripts? Does that happen in the medical industry?
Doctors are humans and they do those things.
It's amazing.
Yeah,
I can't
shocking.
believe that an actual doctor would say, let's run 400 tests that they're able to make $400,000 on.
Right.
It's, well, again, you're right and it's not right, but they're not trained in prevention. So,
and that's the key I'm trying to highlight here.
No one's trained in prevention, and they're trained to treat illness.
Reactionary.
And symptoms. So symptoms generate testing, or an established disease generates testing and follow-up if you want to be nice about it. But it's so, and there's a lot of CYA about that too. I don't want to get sued for missing a diagnosis, but it's just about, there's no training at all. And the part of that is there's no money in it.
Right.
The system survives.
Make a lot of money,
The system wants you sick.
It does.
And I've always said the smartest people in the world work for health insurance companies. So I don't have any proof on this. So let's say allegedly, my observation is, for them to raise premiums even a little bit every year, there has to be an increase in the cost of care.
Exactly.
And the system,
to justify that significant increase in every annual renewal.
And so they're managing, again, I don't have any proof of this, but I think they're orchestrating the slow increase in chronic disease
Wait a minute,
in our
you
country.
think they're orchestrating to drive more revenue for an insurance company?
I have no proof of that, but it seems like that might be
crazy that could be the case in America to capitalize on opportunity like that.
So the good news is now there's opportunity, and we've found together, me and my team, of which, full disclosure, Sean's on the team.
Yep. Grateful.
We're recognizing that there's opportunities now in prevention, and huge opportunities because they're there. And so few doctors understand prevention. And so again, it's all there.
So that's a great lead into my next question, right? So you focus on prevention, which is the beginning of your process, right? So would you talk through the HuBe Health process, like how you don't have to go granular, but speak to it as how HuBe Health functions so that people can experience proactive, preventative medicine?
So the key to prevention is screening. And I've had patients tell me in the past, you're fishing for things. So if you apply the traditional mindset of, I can bill for diagnosis.
Look for it, you'll find it. Yeah.
Right. Well, screening is how you prevent disease. Okay, let me find someone early on the disease spectrum. So now let's think of disease as a spectrum where one day you had nothing and the next day you have the very first beginning of a disease occurring. But it might take, like in the case of diabetes, 20 years for that disease to develop to a point where it reaches enough damage to trigger a diagnosis.
And at that point, you might be older and your body's in a totally, you're at a different age point of your life and you're probably not as healthy and able to recover.
Well, you're not as healthy because the first day, that process, let's not call it a disease, let's call it a process. That process is beginning to damage your body just because it isn't being noticed by the system.
Right.
Because it's not bad enough. You haven't triggered some surrogate marker. That's the other reason people think the system's broken or they may not realize this, because the markers that they're following are the wrong markers.
Right.
And so a surrogate marker gets triggered. Oh, now I have this disease. Well, what about yesterday? What about the day before? What
about 3 years or 10 years before?
15 years, right.
Correct.
So this time under the curve is damage to your body. So the sooner we recognize you're on this path, even if it's day one, we can take action and stop it. And if you're further down, there's opportunities to reverse the clock and pull it back and add years of not having this condition.
Wow.
This episode of The Business Chat is sponsored by Exodus HR Group. For over a decade, Exodus HR Group has helped owners find their path to business freedom by alleviating distractions and allowing owners and executives to do what they do best, put their focus on overall business growth and strategy. Exodus HR offers services in payroll, tax, comprehensive HR, employee benefits. Look, there's a lot of great tools out there, a lot of apps online that you can get to manage your human resources. But when you're looking for a real partner, humans that pick up the phone, someone you can trust, check out Exodus HR, your HR partner, not just a service. To learn more about Exodus HR Group, visit exodushrgroup.com.
And so the neat thing about it is that obviously I've been honored to be part of kind of this HuBe Health launch piece, right? But is that what I think is kind of neat about it is that you do it, you come to an organization, those that qualify, you come to their organization twice a year with your team, and we do a health fair. Now, for those of you listening, it's not like a carny, so I just want to let you know. So, like for some of my friends and your friends, it's not a carny, guys. Sorry,
not
it's
a
not
traditional
that kind
fair.
of it's not that kind of health fair. Those people need to come to a HuBe Health. But anyway, so I digress. But with regard to these, so the health fairs that they have, would you talk about, like they're twice a year, that people, then you bring this preventative medicine preventative program to them for the employees and their spouse to participate in those that are on the, self-insured program, whatnot, if you will. And it's education with purpose and fun. And I think that that's a neat thing. Will you talk through like the health fair and how that works? Like, I just think that's super fascinating and it's super cool.
Well, yeah, it's just data collection. Nobody wants to say, "Oh, I'm going to my data collection meeting." It's just, you call it a health fair, but it's,
right.
So we collect different types of information that I think.
Will we get cotton candy and popcorn? And funnel cakes.
We already said it's not a carny. We've already established that. Is that the trick question? You told me I was going to get a trick question. Is that one of them?
You picking up on his theme here? When and where is the food?
Right,
Yes.
right.
Yes.
So it's the data that I feel is important to know that tells me where are you on the spectrum of disease, of the diseases that we're screening for. Mm-hmm. So you just come in and we get some blood, we do an ultrasound, you do a 15-minute computer test that you're going to hate, because it's a little challenging.
Yeah.
We do your body composition.
Got it.
I mean, it's simple stuff. It takes 30 minutes tops. You're in and out. And then what's nice,
and I don't have to go to my annual checkup, which I don't like to go to anyway.
No,
I can just come down to the lobby and sit in a comfortable chair, even though I'm not getting cotton candy, and someone can walk me through this, and I'm in and out in 30 back on my back in the job.
Exactly. So the idea is that this is where I've kind of observed in my practice, and I'll say practicing on my patients, is at some point I realized I'm not needed. Like the data tells everything.
Right.
And so it's just about collecting the data. So no, you don't need to go to your doctor, because when you go to the doctor who's operating with
awesome.
Yeah, and so
well, they want to know why.
Sean and I
They may want to know why they don't have to go to the doctor.
Can you so expand this, right? Because I think it's kind of funny. So I love that. But in addition to the fact that, so you do the health fair, you then the follow-up. What does the follow-up look like, and the frequency of going
what's that
through
experience like? Right.
And it's even before. So, should you qualify, then you start getting education about the process. What are we doing? Why should you show up for the health fair? And education about the diseases, so that when you get your results, you're seeing some of these videos now for the second. We're educating through emails and videos.
Okay.
And they're simple. They're 60 to 90 seconds, and they go through a lot. I don't expect anyone to watch their video and their results to be able to spit back to anybody, regurgitate where they are, because it's just too much information. But over time, you kind of get it.
Right.
It's not like a one-time, I understand this. But over time, and hearing it repeatedly and watching your results change, it'll sink in. So it's education, show up, go through the health fair, and then it takes us a couple of weeks to kind of get all your testing together and deliver results. So we're going to tell you what you've got to eat, the exercises you should be doing, and prescriptions that we think you might need, we send. So it's not about not doing prescriptions. It's about not having a heart attack or stroke and not dying early. It's about prevention. So sometimes we need meds to prevent diseases. And all year, education about where you are and reminders to do the things you've got to do as a patient, someone who doesn't want to be sick. And then we come back after 6 months and do just a blood draw, not the whole health fair, but a blood draw. And that tells us a lot about, change. Where have you, what's evolved in the process.
Since the last time. Yeah.
Right.
And I think that kind of answers the next question, which was the differentiator is the prevention approach. Would you agree?
It's a lot of things.
It is a lot of things.
Yeah, it's a lot of things. Yeah. So, but the main one to me is about the data. Is that, so when you you don't have to go to your doctor. Well, your doctor's getting the wrong tests. And
give me an example. What do you mean by that?
Well, like cholesterol doesn't predict risk, But cholesterol's the LDL, which is considered the bad cholesterol, is considered the main reason you do or do not get a cholesterol drug to prevent you from having a heart attack. And that is the single worst data point, in my opinion, that measures risk. But it's the main data point our healthcare system is built on to make that decision. And same with hemoglobin A1C. Now, this one's a lot more controversial, but I think it's a useless test. But it's the main test everyone uses to measure, are you diabetic or not, and how well controlled is your diabetes, and the goals set by our organizations and institutions are so bad. Like they're so weak. Like, oh, you can have an A1C of 7, 6.5. It's like, those are horrible. But if you walk to your endocrinologist, to the doctor who's the specialist in diabetes, and you're a 7, they're going to throw a parade for you.
Yeah, right.
And it's a horrible number.
And it seems like the conventional wisdom isn't just dated. It gets very myopic and tunnel vision, right? Like you see folks stepping up going, hey, there's actually this thing called lectins, and there's other things happening in our diet that actually this obsession with carbohydrates and stuff, it's like, yeah, but it's a much more holistic way to eat. And conventional goes, well, no, here's the food pyramid, right? Like the old food pyramid. It's very dated.
It's garbage.
Yeah.
It's all, it's... We all know. Well, Ken, maybe
garbage
we all don't
evil.
know.
Yeah.
It's
I like his theme with it. He goes, so they're terrible people. He's really baiting this guy today. I like it.
Right.
I'm easily baited.
Exactly. No, but continue.
The doctor evil.
So it's just like that. Even the food business is all based on who's making money, how they make the most money. The government's being paid to do all these things. So we have an opportunity to pull.
I'm surprised that you think the government's being paid.
Yeah, what's this guy talking about? Well, as this episode's
in
clearly...
America? That would happen in America?
That's what I've heard. Again, I don't have proof of any of these things, but
I saw the Food Babe interview the other day on TV, and she was talking about it. I know she's a huge advocate for it. I'd love to have her on the show sometime.
As this is really shaking out to not really being a pick-me-up, right? Evil food, evil pharma, evil... To keep us on track, though, so thank you. The differentiator is a lot of things. I see the preventative element.
The main one's the data. Well, it's about using, it's the right data. You have an opportunity to pick what you need to achieve the goals that you want, and have the right data. Be able to recognize that you don't need to see a doctor to do all this stuff, that it's all automatable.
Right.
And you can follow these things and you can add to them. We're starting, we're HuBe 1.0.
Okay.
We got to have a lot of things to add. Prevention covers a lot of ground.
Right.
So we're going to keep adding data points that are important to me.
So the impact to an individual, I think we'll focus there, because I think that's the thought track we've been on. That's listening right now. Is what's the greatest impact you would say is, hey, by following this system, should you be accepted? What are the impacts, or what is the main greatest impact that they will experience? Not just not having to see their doctor, though, right?
Well, you're going to know where you are.
Yeah.
Like, you're going to know exactly where you are
clarity.
health-wise.
Yeah.
Like, there's not going to be a question of, am I going to have a heart attack or stroke? Where am I on the spectrum of becoming diabetic? We know. Like, I have...
Can you talk about some of the patients you've helped? Obviously not their names, but
sure, give us
the
a story.
Impact, which is so amazing. I think people need to hear how you have helped your patient. It's life changing. Can you share?
I'm going to start with a couple good ones and then maybe a bad one.
They're all great.
Right, they're all good. So, so for instance,
everyone listen in.
One
right now.
Man, he's I'll say a little younger than me.
Mm-hmm. About 30. Yeah.
He went to his doctor. Right, thank you.
Yeah.
He went to his doctor.
Happy 31st, by the way.
That's right.
Thank you. He did what he's supposed to do. Mm-hmm. He went, got his testing. The doctor even did a stress test on him. Mm-hmm. He's all happy, and he goes and has a little stroke, and goes back to the doctor. What do I got to do? I had the stroke. He's like, let's do one other thing. You're good. 2 weeks later, the guy wakes up in the ICU having had a massive heart attack.
Oh,
And
that's a bad month.
That's a bad month. And that guy, and again, the doctor did what the standard process is, because the standard process doesn't identify risk. Like they used his LDL, they looked at his sugar and did what they thought they needed to do, but obviously did not prevent this guy from
So you're
having
saying this
an
poor
event.
brother goes and does what he's supposed to do, right? He has a stroke. He then goes back and says, hey, I think there's a problem. He then has a heart attack, wakes up a couple weeks later as a heart attack in the hospital.
Yeah. And so this guy, he comes to see me, and, you know, I call them drivers of disease, you know, all the different things that contribute to where are you on the cardiometabolic disease spectrum. And this guy has all of them, you know, all of them.
Right.
And so it's a process, you know, we're just patching him together and managing to find and make sure he's staying on track of treating all the different drivers of disease that he has. And now he's way off that ledge. You know, he's way off it. Is he perfect? No, but we know where he is.
Yeah.
And we can see it clearly. So on the flip side, you know, a bad story is someone joins the practice. He comes in. Again, this is not HuBe necessarily. This is stuff within my practice,
right?
In the concierge side. So he doesn't listen to me. He has high risk markers. We give him his instructions. He doesn't follow them. He misses his follow-up appointment to get additional set of blood for progress.
Ooh.
He misses that. And maybe like 3 or 4 months later, I'm getting emails from him, you know, an x-ray report where he's got an endotracheal tube in. And I'm like, oh my God, this guy's dead. You know, and I call him, and he answers thankfully, and he had a massive heart attack. And he said, I didn't listen to you.
Wow.
And had he listened to me and kept his appointments and followed up, there's no way he would have had a heart attack. No way.
Wow.
So that to me is what's amazing, is because you let people, you give them the right and the autonomy to live their life the way they want to live, but you just want to help them live a healthier life with simple things and insight. I think that's what's so amazing with what you do.
Thank you, but they do need to do what I ask them to do.
Well, doing what they ask,
Right.
but I think that
Well,
to me, it's like you help them and you want to shepherd them along the way to lead a better life, but you're that health advisor.
And a lot of times you have time, like, you know, to say, okay, we have time to work on this. And like the guy who didn't listen, he didn't have that much time, you know, and it's, well, 'cause it was only 6 months, you know, all told. And, you know, he's alive, but, you know, he's not, now he's got chronic disease. Now he's got heart failure. His heart's barely working. And he's a mess. Like, you know, and he's anyway.
And probably representative of so many Americans. It's a unfortunately common, right?
50% of people who have a heart attack are doing what their doctor says.
That's what I'm
right.
That's amazing.
And so it just goes to show you that they don't have the right information to make a decision.
Right.
Because it doesn't pay
And it's
within
almost,
the system as it exists.
Yeah, and not to hijack for another longer, because again, we could be here all day with this one, but this is implying, and there's got to be folks listening going, is this guy saying he can predict? It sounds like there's a predictive element. You're talking about a more matter of fact, right? You do this fair and blood, and you can say, hey, we can guarantee this is going to happen or not.
I'll say for legal purposes, I don't say guarantee,
but
is
a
correct.
really inappropriate word.
Yeah, but I'll say
I'm speaking for the guy that's going, excuse me, but no, I understand.
I have a very high level of confidence in our ability to predict risk.
Okay.
And that if someone does what we say, that we're going to walk them back off that risk.
And listen, better than what they're getting today is, that's exciting, like you keep saying, but it sounds even better than better.
So, well, to talk about that, when you go see I'll even say cardiologist, and you go to get I have a little twinge or whatever reason they want to conjure up to do a stress test. You go do a stress test. That test is screening you for surgery. So what I mean by that is it's screening you for, do you have a blockage that's blocking your artery flow that is impacting the supply-demand ratio of blood getting to your heart? You know, if you need more blood because you're on a treadmill but there's a blockage where only 10% of the blood's getting through, well, that's going to trigger an abnormal stress test, and the cardiologist sets you up for a procedure or surgery, and that's
bypass or catheterization or whatever.
But that's not what causes heart attacks. What causes heart attacks is an inflammatory process, and doesn't have to happen in someone who's got a 90% blockage. It could happen when you have a 40% blockage or a 50% blockage, and there's no flow issues.
Sure.
You know, so there's no clinically relevant flow problems. You have no idea you have a time bomb in your chest. And so the cardiologist can't tell the difference between totally normal and the day and being at what I'll call risk with high inflammation markers. People that have blockage have symptoms, you know, and that leads to the diagnosis. But even then, medical management is as good as surgery, if not better. So just apply optimal medical management. The problem is they don't have the tools for that.
No, that's a great scenario, though. Thank you.
Well, so our last closing question, right? And I love the information, and I have all sorts of questions that are swirling about like a whirling dervish, right, in my mind that I just want to ask 25 more.
Well, I have a question after your question, if you have a minute.
So
that's allowed.
So my question too is, the last one that I have is, what's the one thing that in your recommendation, right, as a physician, that you believe humans can do to live a life of greater joy and happiness? What's the one thing someone can implement today?
Well, joy and happiness is different than, you know, prevention, being healthy.
Right.
So to me, again,
I'm asking this as just a wise.
Yeah, I understand. And it's thank you. This is my journey in life to date.
Yes,
it's an ongoing piece of work. Be honest, you know, with the people in your family.
Yes.
That's it. You know, just be open and honest with the people in your family.
That's great.
And that is part of the puzzle is being happy.
Yeah,
that's awesome. Great. You had a question for me.
Yeah, who qualifies for HuBe Health? We keep teasing them of how do you qualify
so
for
I think
HuBe
Health. So I think one of the cool things with people that qualify are people, they have to be self-insured.
A company, not a person.
Yeah, a company has to be self-insured, and that can range anywhere from about 60 employees up to 3,000 or 4,000 employees. It's kind of the sweet spot that I see that HuBe can come in and make a difference. It can be bigger than that, but that's kind of what we see in the middle market space. But they have to be self-insured. It has to be somebody that really wants to see positive change in their organization, and they want to see a reduction in their healthcare expense. So one of the things that I see as really, really cool and unique about HuBe Health is it truly makes a measurable reduction in that, aggregate limit that's established every single year.
Right.
Because of the process, the health fairs, and then we kind of joked a little bit about it, but those health fairs are critical. That doing those twice a year absolutely will make a measurable impact, anywhere from 20 to 40% of that aggregate dollar amount. So those of you that are listening that are self-insured, take that aggregate amount.
Right.
If you're self-insured, reduce that by 20 to 40%, perhaps because that's your money. Perhaps that's going to make a difference in your bottom line and going to have a positive impact on your balance sheet.
And the only thing you have to do is think differently, right? Is just be a little unconventional.
Correct.
Try something different to get better results. And there's a savings element to it.
Right. Yeah. Well, to me, it's education, right? And so education through a systematic process to help your employees and their partners and spouses to live a healthier life way, way upstream. And that's what HuBe Health does. It puts you in greater control. People go to that self-insured model anyway to be in control.
That's right.
HuBe Health fans that flame.
Nice.
And instead of you paddling, it puts a,
drops
like a nice, drops a nice, Evinrude right there on your canoe.
How long it would take? When's it going to... So a nice little,
it's exactly. I love my hillbilly friends, right? So that's right. But I think it's wonderful. So so thank you again for allowing me the opportunity to share what HuBe Health does with organizations. And I have fun in everything that I do, but it's really fun to help people have more control and have them, if you're working hard as a business owner, you should have the control of all the dollars you're dealing with. So, and you give them the ability to do that. So
appreciate it. Thank you. Thanks for having us.
Yeah. Thank you for coming on. I really appreciate it.
Yeah. We'll link all of Dr. Kolender's information within the show notes, right, Sean? And, again, for you guys listening to the Business Chat, thank you for tuning in. And again, thanks for being on as a guest.
Pleasure.
I appreciate it. Thank you, buddy.
Thanks.
The Business Chat is a production of Suited and Suited Studios. End the chaos and experience marketing relief with one full-service solution. Visit looksuited.com for more information.